Here is the dirtiest secret in American retirement planning. The United States ranks 37th in the world for healthcare outcomes. 37th. Below Costa Rica, below Colombia, below countries most Americans couldn't find on a map. And yet, you are paying more for that 37th place system than every single country ahead of you on that list. The average American retiree spends $6,800 a year just on out-of-pocket medical costs. That's after Medicare, after premiums, after everything. $6,800 a year that simply disappears before you can spend it on anything that actually makes life worth living. Now here's what nobody in the retirement industry wants you to know. Right now, retirees are living in countries with hospitals that outrank Johns Hopkins by multiple international metrics. Hospitals staffed by English-speaking doctors trained in the UK, the US, and Australia, and paying $80 a month for comprehensive health coverage. Not catastrophic coverage. Not you're on your own until you hit a $6,000 deductible coverage. Actual, walk in tomorrow, see a specialist this week, get an MRI, and walk out with the results coverage. We spent 3 months digging through World Health Organization rankings, OECD health data, Joint Commission International accreditation records, Expat healthcare forums, and first-hand accounts from retirees who made this exact move. What we found is going to challenge nearly everything you believe about what good healthcare costs and where in the world you can actually get it. 8 countries, 8 completely different healthcare systems, counting down from 8 to 1. Stay until number 1, because that's the country that sits at the literal top of the WHO global rankings and will let you into its national health system for less than your current monthly cable bill. Quick note on methodology, because this is healthcare, and you deserve more than a list of pretty countries with vague promises. Every entry on this list had to clear 3 bars. First, a verifiable international quality ranking, Joint Commission International accreditation, WHO rankings, or OECD health outcome data. Second, a documented, accessible pathway for American retirees to enter the system, either through a retirement visa, a national health enrollment program, or a vetted private insurance market with published pricing. Third, actual reported costs from retirees already on the ground, not estimates, not projections, real numbers from real people. We cross-referenced across expat forums, international living surveys, and published insurance rate cards. Let's go. Mexico is number 8 on this list, not because the healthcare is weak. It isn't, but because the system requires the most navigation, and that's worth being honest about up front. Here's the part most people miss entirely. Mexico has 2 completely separate healthcare pathways for foreign residents. The first is IMSS, the Instituto Mexicano del Seguro Social, the National Public Health Insurance System. Foreign residents with legal residency status can voluntarily enroll in IMSS for roughly $300 to $450 per year. Per year. That gets you access to the same public hospital network that covers the majority of working Mexicans. General consultations, labs, surgeries, hospitalizations, prescriptions, covered. The quality varies significantly by location and facility, but in major cities like Guadalajara, the IMSS hospitals are well-equipped and properly staffed. You are not walking into a third-world clinic. The second pathway is private care, and this is where Mexico genuinely surprises people. Private hospitals in Guadalajara and Mexico City, places like Hospital Puerta de Hierro, Tech Salud facilities in Monterrey, hold Joint Commission International accreditation. The same accreditation that certifies hospitals in the United States. A specialist consultation at a top private hospital runs $40 to $60. An MRI, $150 to $200. A full blood panel, $25. Private health insurance that covers these facilities comprehensively costs $80 to $150 per month for someone in their 60s. Compare that to what you're paying right now. The English situation in healthcare is generally strong in expat-heavy areas. Most private hospital physicians in Guadalajara and San Miguel de Allende completed part of their training in the United States. Communication is rarely a barrier. Now the catches. IMS enrollment as a foreigner is technically voluntary but practically inconsistent. Some offices process you smoothly, others create bureaucratic delays. The public system's quality drops noticeably in rural and smaller urban areas, so your choice of city matters enormously. The US-Mexico border situation and periodic travel advisories for certain states are real. Your specific city of residence matters here more than anywhere else on this list. Do that homework carefully. And Mexico's proximity to the US creates a temptation to, quote-unquote, just fly home for serious procedures, which can quietly demolish your healthcare savings if you're not disciplined. The verdict. For the retiree who wants to stay close to the US, keep one foot in familiar territory, and slash their healthcare costs by 70 to 80% without radically changing their lifestyle, Mexico, specifically Guadalajara, is the starting point that makes the most practical sense. We covered Penang in a previous video as a retirement living destination, but it earns a separate, dedicated mention in a healthcare conversation because what's happening in Penang's medical sector is genuinely unusual, and most people don't understand why. Malaysia made a deliberate government-level decision decades ago to build a medical tourism industry. Not accidentally, intentionally. The country invested heavily in hospital infrastructure, recruited physicians trained abroad, pursued Joint Commission International accreditation aggressively, and priced everything to attract the world. That strategy worked, and you, as a foreign retiree, are the beneficiary. Penang has 4 internationally accredited private hospitals within a short drive of each other: Gleneagles Penang, Penang Adventist Hospital, Island Hospital, and Lam Wa E Hospital. These are not budget facilities. These are facilities where the cardiac surgery department and the oncology wing look like the best hospitals in Singapore, which is saying something because Singapore's hospitals are among the finest in the world. The numbers are almost embarrassing compared to the US. A specialist consultation, $25 to $40. A full cardiac workup, $300 to $500. A hip replacement that would cost $40,000 in the US costs $8,000 to $12,000 in Penang. All in, including a private room. Comprehensive private health insurance for a retiree in their 60s through a reputable international insurer, Cigna Global, AXA, Allianz Care, runs $80 to $130 per month. English is the working language of every single one of these hospitals. Your doctor, your nurse, your billing department, the discharge paperwork, all English. This is not a situation where you're hoping someone speaks your language. It's the default. The catches. The Malaysia My Second Home Visa, MM2H, was significantly tightened in 2021. Financial requirements went up, processing times are slower, you'll need a local agent and patience. Private insurance is the vehicle here. Unlike some countries on this list, Malaysia's public health system is not easily accessible to foreign retirees. You're in the private market. That said, when the private market runs $100 a month for world-class coverage, that constraint is a lot easier to live with. The verdict: best-in-class hospital infrastructure, English everywhere, internationally accredited facilities, and monthly insurance costs that are almost insulting compared to what you're paying now. If the healthcare quality ceiling matters to you, Penang is where that ceiling is highest. Thailand's hospitals have a statistic that still stops most Americans cold when they hear it for the first time. Bumrungrad International Hospital in Bangkok, a single private hospital, treats over 1 million patients per year from 190 countries. One hospital, 1 million patients from everywhere. That's not a fluke. That's what happens when a country builds healthcare infrastructure specifically to draw the world. Thailand has more Joint Commission international accredited hospitals than any other country in Southeast Asia. Bangkok alone has 9. Chiang Mai has 2. These are facilities with internationally trained physicians, cutting-edge diagnostic equipment, and this is the part that gets people: wait times measured in minutes, not months. You make an appointment, you show up, you see the doctor, you leave with answers. The concept of a 6-week wait to see a specialist does not exist in the Thai private system. The costs are where Thailand earns its place on this list. A consultation at Bumrungrad, $40 to $60. A full annual health checkup, comprehensive blood work, ECG, chest x-ray, physical exam, $150 to $250. Comprehensive international health insurance for a 65-year-old retiree through a major insurer, $70 to $120 per month. Dental care is so cheap that retirees fly to Thailand specifically for dental work and come out ahead financially even after factoring in airfare. English is standard at every international grade hospital. Physicians who trained in the US or UK are common. You will not feel like a foreign patient navigating an unfamiliar system. The hospitals have international patient coordinators whose entire job is to make your experience seamless. The catches: Thailand's retirement visa, the non-immigrant OA, requires proof of 800,000 Thai baht in a Thai bank account, roughly $22,000 at current exchange rates, tied up for the duration of your stay. That's money you can't easily access. Some retirees find that requirement frustrating. Additionally, Bangkok's air pollution is a genuine health consideration. During the dry season, fine particulate matter levels can be dangerously high, and for retirees with respiratory conditions or cardiovascular disease, this is not a minor footnote. Chiang Mai, historically worse for seasonal smoke from agricultural burning, has been improving but still has bad months. Choose your city and your season carefully. The verdict: highest concentration of internationally accredited hospitals in Southeast Asia, costs that are almost cartoonishly low compared to the US, English-speaking physicians everywhere, and a system that is actively designed to make you feel taken care of. If Bangkok's air is a concern, Chiang Mai or the resort towns offer a quieter, cleaner alternative on the same insurance. Panama is the only country in Latin America with a consistent presence on global lists of top medical tourism destinations, and there's a specific structural reason for that. Panama City has been actively investing in healthcare infrastructure since the late 1990s, and several of its hospitals have pursued the kind of international accreditation that most of the region hasn't bothered with. Hospital Punta Pacifica in Panama City is affiliated with Johns Hopkins Medicine International. That's not a marketing claim. That's a formal clinical and quality management relationship with one of the most prestigious medical institutions in the United States. The standards are audited. The outcomes data is tracked. You are not taking a blind leap of faith when you show up at that hospital. Panama's Pensionado Visa, one of the most generous retirement visas in the world, doesn't just give you residency. It gives you a 20% discount on private medical consultations, a 15% discount on hospital bills, a 10% discount on prescription medications, and discounts on dozens of other services. These discounts are legally mandated. They're not at the hospital's discretion. As a pensionado, you get them. Full stop. The income requirement is $1,000 per month from a permanent source. Social Security qualifies, and processing is more straightforward than most other countries on this list. A specialist consultation in Panama City runs $50 to $80. Comprehensive private health insurance for a retiree in their 60s, $100 to $160 per month. Higher than some of the Asian destinations, but Panama's proximity to the US, English prevalence, and dollar-based economy make the premium feel justified for many retirees. Panama uses the US dollar. There is no currency risk, no exchange rate to watch. What costs $60 today costs $60 next year. English is widely spoken in Panama City's business and medical communities. Most physicians at top private hospitals trained in the US or are board certified by American medical boards. For a retiree who wants medical quality they can actually reference and compare to US standards, Panama provides a level of familiar credentialing that matters psychologically, even if the cost savings are just as real elsewhere. The catches. Panama City is a city, and like any city, it has traffic, noise, and inequality that's visible in ways that can be unsettling. Outside Panama City, healthcare quality drops off significantly. If you want to retire to the mountains of Boquete or the beaches of Bocas del Toro, you need to understand that your excellent hospital is a 2 to 4 hour journey away. For routine care, that's fine. For emergencies, that's a real consideration. Budget for serious medical travel and make sure your insurance covers medical evacuation. The verdict. Johns Hopkins affiliation, US dollar economy, mandatory pensionado discounts, and a retirement visa that requires nothing more than your Social Security check. Panama is the easiest transition on this list for someone who wants genuine, world-class care with the least amount of unfamiliar friction. We are now entering Europe, and that matters for a specific reason. The European healthcare systems on the remainder of this list operate on a fundamentally different model than anything in Asia or Latin America. They are national systems, not just private hospital markets, and as a resident, you can actually enroll in them. Portugal's Serviço Nacional de Saúde, the SNS, is a universal public healthcare system that covers all legal residents of Portugal, Not citizens, residents. If you hold a valid Portuguese visa, the non-habitual resident program, the D7 passive income visa, or the newly reformed golden visa pathway, you are eligible to enroll in the SNS. Primary care, specialist referrals, hospitalizations, emergency care, prescription subsidies, the same system that covers 10 million Portuguese people. And as a registered resident, your contribution to that system through Portuguese taxes is either minimal or zero, depending on your income structure and NHR status. For retirees who want private healthcare on top of or instead of the SNS, Portugal's private market is excellent and affordable. Hospitals like Hospital da Luz in Lisbon and Hospital CUF Porto are modern, well-staffed, and English-friendly, particularly in Lisbon, Porto, and the Algarve coast where the expat population is large. A private consultation runs $50 to $70. Comprehensive private health insurance in Portugal for a retiree in their mid-60s runs $80 to $140 per month. Portugal itself scores consistently well on European healthcare quality indices. Lisbon and Porto both have hospitals with strong outcomes data and specialist departments that rival anything in Western Europe. And the quality of life context matters here too. When your healthcare is integrated into a life that includes Atlantic coastline, year-round mild weather, fresh seafood, walkable historic city centers, and one of the lowest violent crime rates in Europe, the healthcare isn't just a benefit, it's part of a complete picture. The catch is, Portugal has been discovered. Lisbon and Porto are significantly more expensive than they were 5 years ago, and rental costs have climbed to levels that price out the $1,500/month budget in city centers. The Algarve and interior regions are still affordable, but your hospital network thins out as you move away from the major cities. The NHR program, the tax-advantaged residency scheme that made Portugal so attractive to retirees, was restructured in 2024, and the terms are meaningfully different from the version most articles still describe. Verify current requirements from official sources before making decisions based on anything written before 2024. And bureaucracy in Portugal is genuinely slow. Appointments at government offices, visa renewals, SNS enrollment, all of it moves at a pace that will test your patience, especially in the first year. The verdict: European standards, an actual national health system you can enroll in as a resident, an Atlantic coastline lifestyle, and monthly private insurance costs well under $150. For the retiree who wants Europe, real, functioning, beautiful Europe, without paying Paris prices, Portugal is where the math still works. Costa Rica is a country that has been quietly embarrassing the United States on healthcare outcomes for 2 decades, and almost nobody talks about it in those terms. So let's talk about it in those terms. Costa Rica's life expectancy is higher than America's, its infant mortality rate is lower than many US states, and it spends per capita less than 1/8 of what the United States spends to achieve those outcomes. The vehicle for that is the Caja Costarricense de Seguro Social, everyone calls it La Caja, the National Universal Healthcare System. Here is the remarkable part. As a legal resident of Costa Rica, you are required to enroll in La Caja, and your monthly contribution is income-based. For a retiree living on $2,000 per month, that contribution runs approximately $70 to $100 per month, not as an add-on, as your primary, comprehensive national health coverage. Hospitalizations, surgeries, specialist care, lab work, imaging, prescriptions, all covered. The same system that Ticos, Costa Ricans, use, and that Costa Rica uses to achieve those life expectancy numbers. The private system runs in parallel, and it's exceptional. CIMA Hospital in San Jose holds Joint Commission International Accreditation. Clinica Biblica has been treating foreign patients for over 100 years. English is spoken at every private facility in San Jose. Private consultations run $60 to $90. A cardiac catheterization that costs $30,000 to $50,000 in the United States costs $4,000 to $6,000 at CIMA. Costa Rica's Pensionado visa requires a monthly income of just $1,000 from a permanent source. It grants permanent residency, the right to import your household goods duty-free, and legally mandated discounts on a range of services. More importantly, it gives you the La Caja enrollment right that makes $80 a month national healthcare coverage a practical reality. The catch is, San Jose's traffic is among the worst in Central America. If you want to live on the Pacific coast or in the mountains of Monteverde, both of which are extraordinary, you're further from the best hospitals. La Caja's facilities outside San Jose are more limited in specialist capacity, so complex procedures typically require travel to the capital. Wait times within La Caja's system can stretch for non-emergency specialist appointments, weeks to months in some cases. Many expats maintain their La Caja enrollment for emergencies and hospitalizations while using private care for day-to-day consultations. That dual-track approach costs more but optimizes your experience within the system. And Spanish is the dominant language in healthcare outside the private facilities in San Jose. Learning at least conversational Spanish is not optional here, it's respectful and practical. The verdict: a national health system that by measurable outcomes genuinely outperforms the United States, enrollment available to legal residents for under $100 per month, a parallel world-class private system for routine care, and a country whose healthcare statistics embarrass the U.S. system in the quietest, most damning way possible. Costa Rica doesn't just offer affordable healthcare, it offers better healthcare for less. That's a different claim entirely. Most Americans have never seriously considered Taiwan, and that's a gap in their thinking that this entry is going to close. Taiwan's national health insurance system, the NHI, is, by any serious international metric, one of the best designed healthcare systems on Earth. The Commonwealth Fund, OECD analysts, and health economists who study systems comparatively tend to hold Taiwan up as the closest thing to a functional model that actually works. Universal coverage, no claims denials, no network restrictions, no pre-authorization for most procedures. You see the doctor, the NHI pays. That's the system. It was built in 1995, partly using the American system as a cautionary example of what to avoid, which tells you something. Foreign residents, including American retirees on long-term visas, can enroll in the NHI after 6 months of continuous residency. The monthly premium for an individual is roughly $30 to $35. $35 per month. For national health insurance that covers hospitalizations, specialist visits, emergency care, dental care, traditional Chinese medicine, prescription medications, and mental health services, in a country whose healthcare outcomes rank in the top 5 globally for most indicators. There is no comma missing in that sentence. $35 a month. Taiwan's Gold Card visa, officially the Employment Gold Card, is a combined work permit and residence visa designed to attract foreign talent, and it's been used by American retirees with passive income, freelance income, or professional credentials. The income threshold is $5,700 per month or equivalent, which is higher than some other countries on this list, but it grants a 2 to 4 year renewable residency with a direct path to NHI enrollment. The hospital quality is not an abstraction. Taipei's major hospitals, National Taiwan University Hospital, Taipei Veterans General, Changgung Memorial Hospital, rank on global lists alongside Mayo Clinic and Charité. English is commonly spoken at major urban hospitals, and Taiwan's medical culture tends toward thoroughness and genuine patient attention in ways that American retirees consistently describe as noticeably different from U.S. experiences. Beyond the healthcare, Taiwan is safe, consistently one of the lowest crime rates in Asia. Taipei is a world-class food city. The high-speed rail connects the entire island in hours. The culture is warm toward foreigners in a way that feels genuine and unperformed. The catches. Taiwan's political situation, its relationship with China, is a real consideration that belongs in any honest analysis. Most security analysts consider the risk of active conflict low in the near term, but it's not zero, and you should weigh it with clear eyes. The Gold Card income threshold is the highest barrier on this list and will screen out some retirees. Taiwan's summers are hot and humid, with typhoon season running May through November. Not catastrophic, but meaningful. And while English is common in Taipei's medical centers, outside the capital and outside hospitals, Mandarin is the dominant language. Daily life requires either language study or a tolerance for navigating without it. The verdict: the best designed national health insurance system on earth, $35 a month, world-class hospitals, a country that is genuinely safe and genuinely welcoming. If your income clears the Gold Card threshold, Taiwan is the most extraordinary healthcare story on this list. It is not close. In 1997, the World Health Organization undertook the most comprehensive comparative ranking of global healthcare systems ever conducted. They evaluated 191 countries across overall health outcomes, fairness, responsiveness, and financial protection. The country that ranked first, not second, not third, first, was France. And France has never stopped being first, second, or third in subsequent analyses by major international health research organizations. France's assurance maladie is a national health insurance system that covers roughly 70 to 80% of all medical costs for enrolled residents. The remaining 20 to 30% is covered by a supplemental insurance policy called a mutuelle, which runs approximately $50 to $100 per month for a retiree. The total monthly cost for comprehensive, first-ranked in the world healthcare coverage, $50 to $100. That is what you're looking at. American retirees can access this system through legal residency. France's long-stay visa for retirees, the Visa de Long Séjour Visiteur, requires proof of passive income sufficient to support yourself without working, roughly $1,500 to $2,000 per month documented income, and after 1 year of residency, you become eligible for Protection Universelle Maladie, PUMA, which enrolls you in the Assurance Maladie system based on your residency status alone, not your employment or nationality. You become a resident, you enroll, you are covered. The process is bureaucratic, it takes time, it works. What does that coverage actually mean? Every general practitioner in France operates under the national fee schedule. A GP consultation costs €27, roughly $29, and the majority of that is reimbursed by Assurance Maladie. Your mutuelle covers most of the rest. You walk out having paid a few euros. Specialist visits work similarly. Hospitalizations, the national system covers the majority. Prescription medications, many cost €1 to €5 out of pocket. Not as a subsidy program for low-income patients, for everyone enrolled in the system. The hospitals. France has 3,000 hospitals. The CHU network, Centre Hospitalier Universitaire, are academic medical centers in every major French city that rank alongside the finest hospitals in the world. The Gustave Roussy Cancer Center near Paris is consistently ranked the top cancer treatment center in Europe. Cardiology, neurology, orthopedics, French medicine produces outcomes at the highest tier of any global ranking. And French physicians, required to complete long, rigorous training programs with high clinical standards, have a reputation for thoroughness that retirees who've experienced both systems describe as genuinely different. Where do you actually live in France on a retiree's budget? Not Paris. Paris is expensive, and we won't pretend otherwise. But France is not Paris. Bordeaux, Montpellier, Lyon, the Dordogne Valley, Provence, Brittany. There are regions of France where a furnished one-bedroom apartment costs €600 to €800 per month, where the markets overflow with food that would be considered artisanal and expensive anywhere else, and where the quality of daily life is simply without parallel. A glass of local wine with dinner, €3. 10. A 3-course lunch menu at a neighborhood restaurant, €14. English is less universal in France than in the other countries on this list, and that's worth taking seriously. French people appreciate effort. A basic working knowledge of French opens doors that pure English reliance closes. Many French physicians speak some English, and in larger cities, the English coverage in hospitals is workable. But this is not Malaysia or the Philippines. You will need French, or at least the willingness to learn it, to live here fully and gracefully. The catches? Bureaucracy in France is legendary in its complexity and its patience testing slowness. The visa application, the residency registration, the PUMA enrollment, each step involves paperwork, appointments, waiting, more paperwork. A specialist immigration attorney or a relocation consultant is not optional for most people. It's the difference between getting through the system in 6 months and losing a year to procedural dead ends. France also taxes foreign income in ways that require careful structuring with a cross-border tax professional before you move. The US-France tax treaty protects you from double taxation, but the mechanics require advice, not assumptions. French winters vary enormously by region. The south is mild, Paris and the north are gray and cold for months. Match the region to your temperament. And the cost of living, while dramatically lower than comparable American cities, is higher than every other entry on this list. $1,500 a month works in rural France and smaller regional cities. In a major urban center, budget $2,000 to $2,500 to live without constraint. The verdict. The #1 ranked healthcare system in the world. Enrollable for under $100 a month in supplemental premiums after 1 year of residency. In a country where the GP costs $29 and the hospital is a world-class academic medical center. You pay $100 a month, you get France. That's not a trade-off. That's the clearest argument on this entire list, that the version of healthcare you've been sold in America was never the only option, it was just the only one they showed you. 8 countries, 8 completely different answers to the same problem. The problem of paying $700, $900, $1,200 a month for American health insurance, that still leaves you exposed, still makes you fight for approvals, still sends you a bill after the bill. Mexico, $300 a year for national public enrollment, $80 a month for private coverage, and hospitals with Johns Hopkins equivalent accreditation a short drive away. Malaysia, 4 internationally accredited private hospitals in Penang alone and comprehensive international coverage for $100 a month. Thailand, more JCI-accredited hospitals than any country in Southeast Asia, wait times measured in minutes, and dental care so cheap retirees fly there for cleanings. Panama, Johns Hopkins affiliation, US dollar economy, legally mandated pensionado discounts, and a retirement visa that asks only for your social security. Portugal, an actual national health system you enroll in as a resident, for a country that sits on an Atlantic coastline and charges you $80 a month for private coverage on top. Costa Rica, a national system that statistically outperforms the United States, La Caja enrollment for under $100 a month, and SEMA Hospital doing cardiac procedures for a fraction of US cost. Taiwan, the best designed universal health insurance system in the world, $35 a month, in a country with the safety and culture and food that no one is talking about enough. And France, the #1 ranked system on earth, $50 to $100 a month, a GP for $29, a hospital that would be considered elite anywhere in the world, and a quality of daily life that has no American equivalent at any price. The world is not trying to hide these options from you. They've simply never been placed in front of you in a way that made the comparison impossible to ignore. Now you've seen the comparison. The gap is not a small one. But here's the thing most people skip when they get excited about a list like this. Moving your healthcare abroad is not like switching insurance plans online. Every country on this list has traps, visa requirements that changed last year, healthcare systems that work beautifully in the capital and fall apart an hour outside it, bureaucratic processes that will test the outer limits of your patience. The difference between a retiree who lands smoothly and one who gets stranded halfway is almost always the same thing. They visited first, they talked to people already living it, and they did not skip the homework because the pictures were beautiful. We've also done the companion research, the countries that used to be on lists like this and no longer belong there. The places where the political climate has shifted, where the welcome mat for Americans has been quietly pulled, or where the healthcare system is fine on paper and a different story when you actually need it. That's the video sitting right there on your screen. It's the other half of this conversation, and it's just as important as everything we covered today. Because finding the right place is only half the work. Avoiding the wrong one is the other half.